The demand for nurses has reached a historic high in the U.S. An already short supply significantly worsened during the pandemic. That has driven the recruitment of foreign-trained nurses to record levels. Correspondent Fred DeSam Lazaro traveled to North Dakota to see the challenges both hospitals and nurses are facing.
It's a long way to just about anywhere, even your neighbor's ranch across the rolling prairies of western North Dakota, where cows far outnumber people. The nearest town of Elgin has no stoplights or fast food joints for its 543 residents, but to people's immense relief, it does have a small hospital.
Our population is mainly older.
We met Charlie and Enid Steinkühler at the Sippin' Chicken coffee shop.
When we need to get to the doctor quickly, it's really good to have this facility here.
We're 70 miles from Bismarck, which is an hour drive. If you had a heart attack, you wouldn't last.
I'll start with new staff members in the last month. So Rose, she's from the Philippines. She's gonna be night charge nurse to start with.
At the Jacobson Memorial Hospital, nursing director Teddy Werner is a rarity. She was born and raised in this area. Most of the 10 to 12 nurses working here come through a revolving door. Temporary so-called travel nurses from across the U.S. and foreign ones on longer contracts.
We've had a group of Filipinos in the past, also a group of Kenyans, so they kind of become core staff. They are here longer. You get to know them very well. Hi, Ladonna. I have a nurse that wants to meet you. Hi.
Hi. Where were you before?
Philippines.
Where?
Philippines. In my country.
Philippines?
Yes.
So we're going to be seeing tens of thousands of Filipino nurses coming to the United States.
George Washington University professor Patricia Pittman says the U.S. has long recruited nurses from that Southeast Asian country, where long-standing colonial ties helped create an American model of nursing education. Pittman says the U.S. was facing a nurse shortage before the pandemic due to an aging workforce and, paradoxically, good economic times when many nurses quit if their spouses are gainfully employed. COVID, she says, rapidly escalated the exodus.
Everything from the first period when there wasn't enough PPE and they felt betrayed by employers that were not protecting them, to issues around having to take care of their families as caregivers themselves, as a female-dominated profession, to just the exhaustion from witnessing so much death and suffering.
So I can choose any patient for this one? Mm-hmm. Okay.
The pandemic also delayed Rose Tasani's arrival here. She was offered this job in 2016, but visa processing, already backlogged, was pushed back further.
That one has a HEPA filter.
With years of experience, the 35-year-old Tasani expects to adapt quickly to the American system, but she did admit to one fear early on.
This is the first time that I'll be handling people from this country, and I don't know if they will accept me based on my skin color, but based on my experience since I came, I don't feel any of that.
I got brown eyes too.
Yes, you do. You're so pretty.
During week one of a 3-year contract, Tasani said she found people welcoming and helpful, helping her make the adjustment to life here.
At the moment, I don't have a car. Once I get that, problem solved.
Until you start driving in the wintertime. North Dakota's cold weather is one reason why most foreign nurses don't renew past their 3-year obligation. Isolation is another. In Dickinson, about 80 miles northwest of Elgin, nurse Raja Oy and wife Noemi arrived from Manila via San Francisco with their 1-year-old son Ryu. Exhausted from all the travel, unsure about the blast of cold air that greeted him.
Nice to meet you.
However, Raja Oy's employer, the 88-bed St. Luke's Skilled Nursing Facility, offered a warm welcome on a busy first full day in Dickinson.
Fingerprints, apartment, shopping. Hopefully you're ready for this.
I'm waiting for it for a long time already.
Yeah.
Raja Oy had waited 4 years since being offered this job for his visa to clear. St. Luke's CEO Amy Cright played tour guide for the day. as he got fingerprinted at the police station, required for new immigrants.
Are you thinking like a sofa and a recliner, or are you thinking a sectional?
As they browsed the furniture store. And most critically, the Oys got to meet Filipino colleagues at St. Luke's, 6 of the 7 nurses now on staff.
Christina has a young daughter. So if we can have any employee with their family, you're less likely to be lonely. You're more likely to be social and out and about versus if your family is across the world. So just having an adequate sized Filipino population in our town is a good asset and resource for them.
One question raised in this story concerns the ethics of rich countries luring away the best talents of poorer ones, whether the Philippines or India, and especially countries in sub-Saharan Africa and the Caribbean, which don't graduate a lot of nurses and desperately need their services.
The World Health Organization has been very concerned about poaching from poorer countries because they're essentially using taxpayer money from those countries to fund our health workforce. I would say at the policy level, however, and at least in terms of Congress, there has been very little interest in this issue.
Did you always want to work in America?
Yes, it's a 13 years dream for me.
You've been dreaming about this for 13 years.
Yeah, since I passed my exams in the Philippines. This has always been my dream.
Tasani and Roger Oy say nurses get little respect in the Philippines, a complaint echoed among American nursing groups. But back home, it's also reflected in pay, which Oy says is about 1/10 of what they'll earn here in North Dakota.
My goal really is to give my son a better life. So I think being here secures him.
You hear some people sometimes say, you know, it's not ethical for rich countries to take the best brains from poor countries. Have you ever given that any thought?
Well, I think for me, I've spent 15 years already in the Philippines, so I think the service that I gave to the Philippines is enough. So I think maybe it's my time to give for myself to choose for a better life.
How long that will be in North Dakota remains to be seen. 4 more Philippine nurses have been offered jobs at St. Luke's and are awaiting their visa approval. For the PBS NewsHour, this is Fred DeSam-Lazaro in Dickinson, North Dakota.
And a reminder, Fred's reporting is in partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.